Okay, this unit we're going to be talking about the digestive and the excretory system, also called the urinary system. Okay, so you have the gastrointestinal tract is also called the alimentary canal. So it basically includes the mouth, pharynx, esophagus, stomach, small and large intestine. And this is where food is digested and nutrients are absorbed. Accessory organs are things like teeth, tongue, gallbladder, salivary glands, liver, and pancreas. And the difference between them is basically you don't have food moving through the digestive accessory organs, but it does move through the alimentary canal. So the GI tract is essentially a disassembly line. So you're taking food and breaking it apart into smaller and smaller and smaller chunks until it's to essentially the molecule level where it's absorbed into your cells. So there are six essential activities: ingestion, propulsion, mechanical digestion, chemical digestion, absorption, and defecation. Ingestion is where you take in food, so eating. Propulsion is both swallowing and peristalsis, which peristalsis is the waves of contraction and relaxation in the walls of muscles. So you've got peristalsis in your esophagus, moving your food down. You've got peristalsis in your stomach and your small intestine and your large intestine, moving through food all the way through. Mechanical digestion is just any kind of physical breakdown, and this could be chewing, mixing, or churning. Chemical digestion, it has to do with a catabolic breakdown of food. So you usually have enzymes or some kind of chemical that's breaking apart the food into smaller and smaller bits. Absorption is the movement of nutrients from the GI tract into the blood or the lymph. And this is the most important part because it wouldn't do you any good to eat food if you weren't able to absorb the nutrients. And then defecation is the elimination of indigestible solid waste. And it's important to get that out of your body to maintain health. You've got receptors in your GI tract that signal and stimulate your digestive system. You've got mechano and chemoreceptors that respond to the feeling of a full stomach, any kind of osmolarity, so change in concentrations or pH, and the presence of certain substrates, and also the end product of digestion. So as it moves through your digestive tract, it's picking up on these things and responding appropriately. So when your large intestine picks up the fact that you've got waste there, it begins stimulating its peristalsis and other secretions and absorption of certain things. They initiate reflexes that will also activate or inhibit digestive glands and mix lumen contents and move them along. And a lumen is basically the, for example, the hollow part of the small intestine. So the nervous system is very much involved in the GI tract. So just think of, your favorite food, especially when you're really hungry, and immediately your mouth starts to water and it's all you can think about. That's your brain stimulating your salivary glands to start secreting saliva just at the thought of food in preparation of eating. Then once food is in your mouth, you've got chemoreceptors like your taste buds that also stimulate salivary glands, and as well as muscles that are activated for chewing. The distension of the stomach as food enters, and distension means stretching or getting bigger, will increase the production of the hydrochloric acid that's in there and stimulates the walls of the stomach, so they start churning and mixing. The gastric juices are secreted from the cells that are in the lining of the stomach. Peristalsis begins moving it towards the pyloric sphincter, which will then be relaxed to allow food to move through. So you notice here in the stomach, you've also got the rugae, which is kind of this kind of increases the surface area of the stomach and is where all the cells that make the gastric juices are. So we begin in the mouth, which is also called the buccal cavity. And the mouth is lined with a stratified squamous epithelium. And if you remember, stratified means you've got a lot of layers. and squamous are those flattened cells. And you have a whole bunch of layers because as you're eating, chips and chicken and hamburgers, and you're constantly rubbing the tissue in your mouth, and you want lots and lots of layers. If you just had a simple squamous, you would easily cut right through that tissue layer and you'd be in trouble. The gums, the hard palate, and the dorsum of the tongue are slightly keratinized, which means they're slightly waterproof. The oral cavity is basically the area that's within the teeth and gums. If you lift up your upper lip and you see that little piece of skin that connects the gum to the lip, that's called the labial frenulum. You have a hard and soft palate. So the hard palate has the bones, so the skull bones that make up the palatine bones and the processes of the maxilla. This is what the hard palate is, and this kind of helps give your tongue something to push up against, and as you're mixing food, when you're chewing, it kind of gives it something to push up against, which helps form the bolus as well as help you speak. The soft palate is made up of muscle, so no bone there. It also closes off the nasopharynx during swallowing, so food doesn't go up your nose, and the uvula projects downward from its free edge. So the tongue occupies the floor of the mouth and fills the entire cavity when your mouth is closed. So if you relax and you close your mouth and you try to pay attention to the fact that your tongue has completely filled the inside of your mouth. And it helps to grip and reposition food. It helps to mix the saliva with the food and helps with swallowing and, of course, speech. Their superior surface has 3 different papillae or taste buds. You've got the filiform, which is in the front. So if you look at the picture there, and they're kind of sharp and backwards facing, and they kind of provide a lot of friction. So if you ever notice a cat's tongue, cats have really long filiform, and that's why their tongues are so scratchy feeling. The fungiform, which are scattered widely all over the tongue and kind of is what gives the tongue its reddish hue. Then you got the circumvallate, which is the very, very back. Most people can't see those. You have to really, really stretch your tongue out and probably get some kind of mirror, but in order to be able to see those, but they are back there. Then we have saliva that is produced in the mouth and helps clean it. It helps moisten and dissolve chemicals. It has enzymes in it that help break down starch, and it helps form the bolus, which is the chewed up food that you swallow. It's secreted from serous and mucus cells in the salivary glands, and the main digestive enzyme here is salivary amylase. So you've got several different salivary glands. The one underneath your tongue is called the sublingual gland. Underneath your jaw, kind of in the jaw muscle, is the submandibular gland. And then you've got the large one, which is kind of at the base of your where your jawbone meets your skull, and kind of right there behind your ear. Teeth are classified according to their shape and function. You've got incisors, which are good for cutting, canines, which are good for piercing, and then premolars or bicuspids, as well as your regular molars, are broad and are good for grinding and crushing. The tooth has made up of a couple different layers. You've got the crown, which is the top part, and the root, which lies below the gum line. Around the crown, you've got a really, really hard substance called enamel, and that helps protect your tooth, and is also considered the hardest substance in the body, although it can be damaged and eroded due to the stuff that you eat. The root is a portion in the jawbone, and it's got lots of nerves and blood vessels, which is why if you get a cavity that goes down into there, you really feel it. Dental decay, also called dental caries, is the gradual demineralization of enamel and dentin by bacteria. So it's the bacteria that's causing your cavity. So as plaque builds up on your teeth, it consists of a sugar, bacteria, and other debris. It sticks to your tooth. The bacteria start to produce an acid that starts to erode away your tooth and eventually creates a hole. And again, you've got lots of nerve endings and things there, so anything that you eat or drink or even air quickly hits that nerve and hurts pretty bad.